Hi, I'm Susie Garden, and this is the Ageless and Awesome podcast. I'm an age-defying naturopath and clinical nutritionist, and I'm here to bust myths around women's health and aging so that you can be ageless and awesome in your 40s, 50s, and beyond. The Ageless and Awesome podcast is dedicated to helping women through perimenopause and menopause with great health, a positive mindset, and outrageous confidence. Hit subscribe or follow now, and let's get started. Hello, gorgeous one, and welcome to this week's episode of the Ageless and Awesome podcast. I'm Susie Garden, your host, perimenopause naturopath and weight loss nutritionist, proud perimenopause survivor. Yes, I made it through to the other side. And this week's episode, I'm continuing my series on metabolism. And this week I'm going to call it the missing piece, and why muscle is the key to fat loss after 40. This is huge. This is a massive, key to both fat loss, but also just overall health and longevity. And, if you feel like you just can't lose fat anymore, this episode might explain why, because the missing piece for most women isn't effort generally, it's muscle. And firstly, I just wanted to outline how important this is. So we actually start losing muscle mass from about the age of 30. Can you believe it? From about the age of 30, you start losing muscle mass. And when you hit 40, that rate of loss of muscle mass accelerates due to hormonal shifts, perimenopause, menopause, we know. It often results in a loss of, you can be 2 to 3 kilos of muscle per decade if no resistance training is done. And when I was reading up on this, that they're describing that loss of 2 to 3 kilos in your 40s as being modest. Modest. And it can often accelerate to 10 to 20% per decade after the age of 60 to 65. And the reason we see this sudden and sharp decline of muscle during the menopausal transition in your 40s and 50s is because of the lower estrogen levels. And muscle is not just muscle. We have fast twitch fibers, we have slow twitch fibers, and it's the fast twitch muscle fibers that are used for strength and power. They're lost faster than the slow twitch fibers, which means we rapidly lose our strength. And you may have noticed that yourself. I've had so many discussions with women that are saying that particularly ones that have done gym all of their life, they've always had really good muscle mass and strength and definition. And suddenly they're just seeing the skin hanging off them because their muscle is gone. And I remember when I was in my 40s and I wasn't doing a lot of strength training, I was doing mountain biking, but that was only once a week, and walking my dogs. But I really noticed the loss of muscle mass. And I know even just from studies that they've done for patients in hospital, particularly when I was a nurse, the research showed that even after 24 hours of being on bed rest, your muscles start to break down. They can measure muscle breakdown after 24 hours of not moving, of being in bed. So muscle is quite susceptible to breakdown. And if you're also going through perimenopause or you're postmenopause and you're restricting your food intake because you're trying to lose weight, that can actually impact your muscle even more. And so this is a big deal. This is actually a very big deal. And it's not just about the aesthetics. It's not just about being strong. This is about your ability to maintain your quality of life as you get into your later decades. And you may not like to think about that now, but now is the time that you need to be thinking about it, that you need to actually be thinking, man, I want to still be having a really good quality of life in my 70s. So you actually need to be working on your muscles right now, which seems crazy, but this is the thing. Unfortunately, this is just they say life is short, and you really start to realize that when you're in your 40s and 50s that, this aging process is actually starting and accelerating in that period of time. And when, why does muscle matter other than just for your quality of life and your aesthetics, etc., muscle increases your metabolic rate. So this increases your ability to burn energy at rest, while you're sleeping, while you're just sitting watching TV. Muscle improves insulin sensitivity, which means your blood sugar metabolism works better. So that's going to reduce cravings. It's going to reduce overeating of carbs. And muscle also supports fat oxidation. So you really do need your muscles to be present, if not, actively working on them, just even present to keep your body operating effectively and efficiently. So when you lose muscle, basically the opposite of what I just said happens. So your metabolism will slow. So you're going to burn less energy at rest. Fat gain can increase and energy can actually drop. So again, it's how you feel and enjoying your life. If you're feeling really low energy, and then when you try and do things, it's like, oh, everything is such an effort. And I can tell you, because I've been someone that's been at that point when I've been losing muscle, and now I'm on the other side of that where I'm actively building muscle. And one of my motivations, as I've talked openly about, is that I have osteopenia. And so my bones are on the way to osteoporosis, and I do not want that. So one of the lifestyle things for that is lifting heavy. So that's what I'm doing for myself, for my bones. And it's important for every woman for their bones, and men, but women more because of the loss of estrogen. But yes, so we need to be lifting heavy, not only for our bones, but also for our muscles and our metabolism. And I don't know if it depends who you're following on Instagram. I follow a lot of people in research in menopause and perimenopause, and some really interesting stuff coming out now about the muscle-brain connection, and that people that have less muscle seem to be more prone to dementia and Alzheimer's. So moving and using your muscle is actually impacting your brain and your cognition in a really positive way. So there's yet another benefit to lifting heavy things. So even if you can't go to the gym, you may have injuries, you may have financial constraints, there are many things you can do at home to lift heavy, which I'll talk about shortly. So I did want to just mention that cardio is not enough. And cardio is great for your heart. It's great. It does burn energy. It can help with weight management. That's great, but muscle changes your metabolism in a way that cardio doesn't. So if you are specifically looking for weight loss, cardio, as I said, is great. In fact, fat burning, walking is actually really good for fat burning. Walking at a brisk pace where you can only just hold a conversation, that gets your heart rate into the level, I guess, the range that you're going to burn more fat. And then you can switch. If you go jogging, that puts you in a different band with your heart rate, and you don't so much burn fat. It becomes that more aerobic type of exercise. So you do have to be mindful of that. Many people run because they love it, and that is fantastic, but it's not necessarily going to be the best for weight management and fat burning at this stage of life. Food for thought. So what to do? What do we do? So the general recommendation at the moment, and again, on this podcast, it is all general information. I don't know your medical history. I don't know your goals. So anything I'm talking about here is very much general. It's not specific to you. I will always recommend you talk to someone who's knowledgeable in that area, whether it's fitness, nutrition, hormones, etc., to get the right strategy for you specifically. But this is just general stuff. That at the moment, the recommendation is strength training 2 to 3 times a week. 2 to 3 times a week. And lifting heavy, at least your body weight. Now, you do have to be mindful of your joints, of course. And many of us in peri, certainly in peri, I had lots of issues with sore joints. Not so much now. And many women do, or you may have old injuries that mean that the way you lived may need to be modified. And even for someone like myself with osteopenia, I'm very mindful, because my osteopenia is in my spine, is that I don't want to get a stress fracture from compressing my vertebrae doing a heavy lift. So I'm very mindful. I work with a personal trainer who is educated in that method, and I also work with a physio as well, so that I don't injure myself trying to prevent further injury in the future. So strength training 2 to 3 times a week, ideally with a trainer, if it works for you, if financially it works for you, just so you're getting the exercise that's ideal for you. It is way more efficient. Protein intake, protein is super important for building muscle. And this is why we're seeing a lot of conversation about that in the media and these higher intakes of protein. As I said, I think in last week's podcast, there are different schools of thought about how much that is. Anywhere between 1.2 and 2 times, grams per kilo of body weight is what seems to be being recommended. If you have kidney issues, you do need to be very careful about your protein intake. You will probably already know this, but that's just something, if you don't know, that you may need to discuss with your doctor. You need to make sure you're recovering well. So really flogging yourself, like you don't need to go to the gym twice a day. Again, we want to make sure we're not going to injure. And as I'm saying, this is general. If you're an athlete, if you have trained all of your life, you have a very different kind of resilience in your body to this, so you can absolutely do more. But for the average woman who's not really regularly going to the gym or going to the gym to do heavy lifting, you do need to make sure you're giving your muscles time to recover. And we're looking at a progressive overload situation. So you're not going in expecting to lift your body weight on day one. You take your time to build the accessory muscles. You're building your form as well. Again, this is all about injury prevention, but it does take time to get to those higher numbers. So be patient with yourself, and again, get some professional kind of guidance. If you're wanting to do things at home, you can do things with body weight. And I'm not going to give advice on that today, but I'm sure if you went on YouTube, you go on Google, go on ChatGPT, etc., to ask about that. I'm not comfortable giving general advice about that on this podcast, but you can definitely get advice for free. But as I say, you're going to get the best outcome if you get something that's very much individual to you. So I guess that's all I wanted to cover today. I really wanted to focus on muscle itself today and not kind of get too much else into today's podcast. So muscle is the key to fat loss after 40. And if you're wanting to shift weight, but you want to make sure you're not eating into your muscle, then that's exactly what I do with my program, the Glow Protocol. It is a program that does preferentially preserve muscle and burn fat. It's quite a big part of the science behind the program. So if you're interested in learning more, please feel free to book in a peri-weight loss assessment at the link in the show notes, or you could DM me on Instagram. We could get chatting in there if you want to see, so I can understand what your goals are, what's going on in your body, and whether or not this is for you. Thanks so much for joining me on the Ageless and Awesome podcast. If you liked this episode, please make sure you click the little plus button if you're on Apple Podcasts, or the follow button if you're on Spotify, so that you get each new episode delivered to you every single week. If you feel like writing me a 5-star review, you would absolutely make my day. If you found this episode resonated with you, head over to my Instagram and DM me at the Perimenopause Path. I would love to connect with you.